As health expert Professor Tulio de Oliveira warns that immuno-compromised people can produce new COVID-19 variants when the virus circulates and mutates within their bodies. We talk to him right now. Professor, thank you so much for being with us. I guess the understanding is growing that COVID-19 is an ever-mutating virus. What are you finding now in South Africa?
Okay, so good evening to all your viewers. Yeah, so virus do mutate a lot, not only SARS-CoV-2 or COVID-19, but also HIV, hepatitis C, papillomavirus. So it's a common function of viruses. But what we have found this week that was a little bit our fears, is that patients that are immune compromised, for example, in South Africa, in the case from due to HIV and not respond to antiretroviral therapy, but in the UK and the US, due to long-term cancer therapy, they cannot clear SARS-CoV-2 or the virus that causes COVID-19, and the virus keep mutating. And that's what we believe, not only in South Africa, but also in the UK and the US, that is one of the source of productions of variants.
That is very interesting. So it's mutating in their bodies. They can't clear it. Do you mean they are sicker and for longer?
Yes, exactly. So imagine if you have an immune system that's not working very well, which happen quite a lot when people that develop AIDS. The important information here is that people that are well suppressed on antiretroviral therapy, they will clear the virus very well. But if people have a weak immune system because they're developing AIDS or they have long-term cancer, they don't have their immune cells, what it means, the antibodies and the T cells, that's our immune cells, to kill the virus. And that means that the virus, the SARS-CoV-2, keep infecting them sometimes for hundreds of days. Yeah. In the case of this patient, for over 200 days. And during this time, the virus keep evolving.
Okay, so you could watch it evolving in one patient. This is so interesting. Does it mean that people who are immunocompromised should get a vaccine and earlier than other groups?
Yes, exactly. So what it means that people that are immune compromised, especially if due to HIV, they should seek HIV treatment, antiretrovirus. And the good news is that in the last 2 years, the therapy is really good. It is the most tolerable and most potent that ever existed due to new drug class. And in addition to that, we should probably prioritize them from COVID vaccinations. Yeah, what it means that then they could control HIV, and then they could also, if they get infected with COVID or SARS-CoV-2, they would have already the defense then against that virus.
Yeah. I understand you have a view on what's driving infections in South Africa right now, and we see now the dominant variants coming up in different countries. If the third wave in South Africa is being driven by the same variant as the second wave, would that be good news in a way, because it could lead to better outcomes, because some people at least will have some immunity?
Yes, exactly. And we do that in a big collaboration with the NICD, University of Cape Town, Stellenbosch, and many groups in South Africa. We keep following the variant. So at the moment, we have the same variant that caused the second wave. And the main reason why we have the third wave comes so hard in the inland of the country. This means the province of Gauteng, Free State, Northwest, and Northern Cape, is because they didn't have a big second wave. So what it means is that they don't have so many people that have immunity against the virus. So, do we expect the third wave to hit the coastal provinces that had a very large second wave? Yes, but that may be lower, and that may give time to us to vaccinate people, especially in places that do not have a third wave. So, if the third wave comes, it's not as deadly as the second wave.
Okay, that is good news, I guess, depending on where you live. AstraZeneca, it's been reported this week, says it has a vaccine for the variant found in South Africa. Is that good news, even though, you know, we already need those shots in the arm? And what would you say then to people who are getting the vaccine that isn't as effective when something is coming down the line? I guess the advice is get whatever you can, because at least everything right now helps.
Yes, exactly. So one thing that we have found as a scientific community, not only in South Africa, but around the world, is that the vaccines are working even better than we expect. What it means better than we expected, not only countries that have been high level of vaccination, for example, last week, the UK had 0 deaths of COVID for first time for a year. Yeah, but also start decreasing transmission. So the suggestion, South Africa started with 2 very strong vaccines, the Johnson & Johnson and Pfizer. But what we are learning around the world is that even what we call the mix and match, if someone has one vaccine, for example, of AstraZeneca followed by Pfizer, that would be very effective. So that's really reassuring that the vaccines are very effective against the variants.
All right, some good news. Thank you very much, Professor Tulio Oliveira from KwaZulu-Natal Research, Innovation and Sequencing Platform, CRISP.